mTikka is a mobile phone-enabled virtual vaccine registry that was designed to help frontline health workers in rural Bangladesh provide timely immunizations to children in their catchment areas. Designed by Johns Hopkins Bloomberg School of Public Health and developed by Empower Social Enterprises in collaboration with the Ministry of Health and Family Welfare in Bangladesh, mTikka is designed to respond to the needs of community health workers, or CHWs, and their supervisors responsible for immunization services under the National EPI program. mTikka will help these workers manage vaccination sessions and remind mothers when to bring their infants for immunizations. The mTikka mobile application has 5 main functions: registration, vaccinate, list, announce, and reports. Let's start with registration. Here, you can complete a registration form or edit an existing registration. If we select a registration form, we can choose to complete a mother or a child registration. If we select a child registration, we then choose the location information, Upazila, ward, and union. Next, we select the EPI session that the child will attend. We then enter the child's name, select the sex, and enter the child's date of birth. Next, we can enter the mother's name, and then the father's name. Next, we can select who owns a mobile phone in the household. First, we choose if the mother owns a mobile phone. If no, we then select if the father owns a mobile phone. If no, we can then select if they would choose to name a vaccine advocate, someone to receive SMS messages on their behalf. If yes, enter the vaccine advocate name, and the vaccine advocate's mobile number. Next, we can choose to enter a barcode, either by scanning or by entering manually. If we choose to scan, we select Get Barcode, scan the code, and are then informed that the scan was successful and the ID has been assigned. If instead we choose a manual entry, we can enter the ID number by hand. That completes the basic registration. Following basic registration, mTikka walks the community health worker through a basic series of survey of vaccination beliefs, helping the worker provide basic counseling to clients. After each true-false question, the correct answer and rationale are provided. This second question prompts, "My child will fall sick if I vaccinate him or her." After responding true or false, the answer is displayed. This screen reads, "Vaccinations will actually prevent your child from being sick from diseases that can kill." You may see temporary redness in the area where the injection was given, but that should disappear soon. If your child experiences any symptoms of fever, vomiting, or swelling, contact your local health provider immediately for advice. This happens very rarely, and most children do not experience any symptoms after vaccination. After completing the form, press Save and Complete. Next, go to Send Data Now to send the data to the server. Select the data you would like to send and click Send Selected. Back in the registration module, the community health worker can choose to edit an existing registration entry. To access the record, the community health worker enters the child's ID number from the bracelet, scans the QR code from the bracelet, or enters the mobile number given during registration. The application prompts which would you like to change, the mobile number or the child name. If we select mobile number, the system prompts for mobile ownership, mother, father, or vaccine advocate. If we select family, we can then enter the phone number of the family. This is then uploaded to the server. Once sitting at the Outreach Vaccination Center, the CHW can view and update a child's vaccination record in the Vaccinate module. You can again scan the barcode, enter the code manually, or use the mobile number linked with the child to access the unique record. Let's pretend a mother has lost the barcode bracelet provided to her, but that she remembers the mobile number. The CHW can select the child from a list of all children sharing that mobile number with a vaccine advocate. Here, the HA can see the vaccine doses due that day, as well as immunizations due in the future, grayed out below. The vaccine name, dose, and due date are included here. To record a vaccine as given, simply click the vaccine name, respond yes to the prompt screen that the vaccine has been given, and enter the dose's lot number. The schedule for future immunizations is updated and allows the CHW to inform the mother or caregiver when to come back for the next round of immunizations. The lists function has three main subfunctions: the child list, the mother list, and the vaccine advocate list. The child list is designed to streamline the workflow of the community health worker and help them contact families who have not yet arrived at an immunization session. List allows the CHW to view which children are expected to attend that day's immunization session. The list is organized by timely immunization status, with due infants displayed first, followed by the children who have missed 3 or more consecutive sessions. Here you can see the ID, name, mobile number, vaccine, name and dose, due date, and session date. The HA can update a child's immunization record directly from this list by clicking an entry, marking the vaccine as given, and entering the lot number. This method of record retrieval may be useful to access a child record or look up the child ID by name in the case the ID number and mobile number have been lost or forgotten. The mother list uses data on a woman's last menstrual period and her calculated expected delivery date collected on the mother registration form. When a woman's expected delivery date arrives, her information appears on the mother list. The CHW is expected to call the mothers to determine the outcome of the birth. In this way, the CHW becomes aware of a birth in the community much sooner and can register the new infant for immunizations soon after birth. The vaccine advocate list displays the name and mobile number of any vaccine advocates who have recently been registered in the system. The CHW can view each entry and call the new advocates to inform them that they've been registered as such. The CHW can record directly into the application whether or not the vaccine advocate gives consent to be contacted with immunization messages. If consent is given, the registered vaccine advocate will receive reminder messages on behalf of the infant. The announce function sends one of the 2 types of SMS messages sent by mTikka, the announcement SMS. Selecting Send SMS here will push a broadcast SMS to the mobile numbers of children due to attend that day's vaccination session. This SMS is sent by the community health worker once they arrive at the outreach vaccination session and are ready to provide immunization services. This function allows mothers to know that a scheduled session has actually begun and that a worker is available to provide immunization services at that time. The reports function allows the community health worker to view and access a controlled summary report through the web portal. This feature will eventually allow for in-app access to the summary reporting. These documents will be pre-formatted and tabulated according to existing Ministry of Health reporting formats. The final features of mTikka support the primary modules. Review data can be used to view data still on the device and make changes after completion of a form, but before sending that form to the server. For example, if the community health worker realizes she's made a mistake on the EPI session location recorded for the child, she can open the form and change the location before sending the data to the server. The download form function allows easy download of new forms to the device. For example, in the case of a change to the child's registration form, the CHW can load the new form from within the app directly. From the Delete button, completed but not yet sent forms or an out-of-date version of the child or mother registration forms can be deleted from the device. From the Settings feature, the font size can be adjusted along with the server URL if needed. That's it for this demo of the mTikka application. Thank you for listening.